Some people think worse about themselves when things happen. Everything they think about themselves is the worst. They just imagine the worst. There is no optimism in their thinking. All they think about the worst things. Hello, welcome to today's episode of Protect Your Mental Health. My name is Dr. Ebere Nwosu. I am a licensed nurse practitioner specialized in mental health education, diagnosis, and treatment. Today, we're going to talk about the types of depression. Just like I told you in my previous episodes, depression is a complex mental health condition that can manifest in various forms, and those various forms vary in severity depending on individual and trigger. So we're going to talk about major depressive disorder. Major depressive disorder is considered a clinical depression. It is this depression symptoms that have lasted for more than 2 weeks. So when you had, that's what I mean when I said there are difference between being depressed and having depression. So if the symptoms have lasted for more than 2 weeks and is getting more severe, it is considered major depressive disorder.
What are the causes of major depressive disorder?
It can just start. It can pop from the blue. And there is genetic causes, biological causes, psychological causes, environmental causes. So the genetic causes, some people inherit it from the parents. The biological causes is when it starts from the blue, we begin to suspend the imbalance in the neurotransmitter, chemical in the brain that transmits signals from one fiber of the brain to another. If there's any imbalance in this chemical, major depressive disorder can start. The symptoms, you will start having the symptoms. Another thing is the psychological symptoms, like negative thought pattern. Some people think worse about themselves when things happen. Everything they think about themselves is the worst. They just imagine the worst. There is no optimism in their thinking. All they think about the worst things. Then another cause is the environmental factors. The environmental factors can exacerbate depression, like traumatic life events, chronic illness, divorce, separation, financial difficulty, homelessness. All this can cause depression.
What are the symptoms of major depressive disorder?
The symptoms that when you begin to experience, you begin to seek for the help of a professional. Persistent sadness. No matter what you do, you are never happy. No matter what anyone do around you, you're never happy. You don't find happiness at all. You are always sad. Persistent sadness, loss of interest. You always like to go to the gym, you always like to go to parties, and suddenly you see yourself living in withdrawal. You don't want to communicate with nobody, you don't want to go to any parties, you don't even want to answer your call because everything irritates you. Then you begin to eat excessively, or you lose your appetite. You can have either loss of appetite or excessive eating, binge eating. Every time you are eating something, or you refuse to eat at all, lock yourself indoors. So what I'm trying to say is that this major depressive disorder, the severity depends on individual and trigger. Another thing is psychomotor agitation and retardation, like you become restless, or when you want to go somewhere, you take your time to do everything, excessive time to do everything. Then when it becomes so severe, you begin to have recurrent thought of death. That is suicidal ideation. You begin to think about suicide. You begin to think about suicide. Maybe if I die, life will be better. Another symptom is sleep disturbance. You begin to sleep excessively. Maybe you normally wake up by 5 a.m. and you find yourself sleeping till 11 a.m., 12 p.m. You become very tired, fatigue. You're so tired to do anything. You can't even do things that you normally do before with ease. You become so tired and so weak, and either you sleep excessively or you don't sleep at all. So these are all the symptoms you begin to notice. Some people, they begin to notice self-criticism. They begin to criticize themselves. everything is their fault. Maybe if I had done it this way, maybe it's my fault. That's why they are abusing me. Maybe it's been my fault. You begin to criticize yourself. You begin to feel guilt, excessive guilt. You are guilty of everything.
Treatment of major depressive disorder.
The treatment of major depressive disorder typically involve combination of therapeutic approaches and strategies. It is important to understand that the care plan is individualized, because what works for one person might not work for the next person. So it is the duty of a mental health professional to critically assess these patients and find out the severity of their symptoms and treat accordingly. There are so many treatment options that we will explore in our next episode. Thanks for watching Protect Your Mental Health today. In our next episode, we'll be exploring different treatment options for patients with major depressive disorder. Stay tuned. Thank you.
Thank you for watching. Do like, share, comment, subscribe, and turn on your notification bell for next episode.